Joining me on the trapeze are Vermont Senator Peter Welch and Executive Vice President of PhRMA, Elizabeth Carpenter. Welcome to both of you, and let's get right into it. Elizabeth, you know, when you go to the drugstore now, prescription drug prices are high, and maybe you can just take an opportunity to describe for the folks, what are the factors that go into drug pricing?
Yeah, thanks for that question. And I think it's important when we talk about price to be specific about what prices really matter to folks who are listening at home. So it's not really the list price or the sticker price, and it's probably not even the price that your insurer is paying for the medicine. It's what you as an American are paying out of pocket when you go to the pharmacy counter. And the reality is that PBMs and insurers decide what medicines are covered and how much you pay. And in many cases, Americans are actually paying more than their insurer for their medicine. And that's in part because 50% of what we spend on medicines in this country goes to another entity that doesn't make the medicine. So a PBM, an insurer, a hospital, even the government. And so that has an impact on what all of us pay for medicines here. I would also just say that despite that, we have a system that really drives lower prices for medicines over time. After a period of time, lower cost generics enter the market, prices go down. And as a result, what we see is that the US government is actually spending 18% less per prescription than other countries. And we know that medicines are the best value in healthcare. When we spend money on medicines, we also get savings elsewhere in the healthcare system. So these are all really important things to consider.
Yeah, but Elizabeth, I just got to push back quickly. Isn't it a fact that prescription drug prices in the U.S. are higher than they are in most of the other countries in the world?
I'm glad you raised that because there are really pretty specific reasons that there are differences in prices here than there are in other countries. First, and the president has been really clear about this, other countries are not paying their fair share for medicines. And research shows that, in fact, that levies a 26% tax on American patients. And again, when you think about our system, we have some unique aspects. Other countries don't have other entities that are taking 50% of medicine spending. Recent research also shows that, in some cases, PBM fees can be 900% more than the cost of a medicine in another country. So when we talk about these differences, it's hard to ignore those facts.
Peter, your take.
Well, the cost of healthcare, and especially with pharmaceutical drugs, is the highest in the world. And the bottom line, we can't afford it. Prescription drugs in this country cost, in many cases, 5 or 10 times what they cost in other countries. And there's a difference between what the out-of-pocket is. If you're lucky and you have really good insurance, your out-of-pocket might be lower. But the bottom line here, just to give a couple of concrete examples, Ozempic, you have to spend $936 a month to get that. In the United Kingdom, it's $93. It's like 10%. In France, it's $83. Keytruda, which is a very important drug, is $12,000 per dose in the United States. But in Canada, or in the United Kingdom, it's $2,000. And the list goes on and on and on. And the total cost is what you pay out of pocket, what you pay in premiums for your insurance, what the taxpayer pays for Medicare and Medicaid, and then also what employers are paying who are providing employer-sponsored health care. So, I really admire the research and the innovation that our pharmaceutical companies have done, but they're killing us on the price. And it's unique to the United States because of our laws that essentially favor incredible profits for the pharmaceutical companies and incredibly high prices for our consumers and patients. So, you're a family and you've got a loved one who's really sick, and you find out that the medication that can save your daughter's life, your partner's life, costs $125,000, you're gonna take a second mortgage if you're lucky enough to have a home. You're gonna wipe out your savings in order your retirement account, and these prices are just too high. And by the way, pharmaceutical profits are enormous. The executives in many cases make over $100 million a year. And then the trillions of dollars in profits go not back into the healthcare system, they go into stock buybacks and dividends.
So, Elizabeth, what about that? Do pharmaceutical companies have very high profits? Just briefly.
Yeah, I would say that if we're going to look at profits, we should look at the money that insurers and PBMs have made over the last decade, really profiting off of medicine prices. And when we talk about reinvesting in the healthcare system, I don't think there's a better example than the biopharmaceutical industry. We know that it takes roughly $2.6 billion and 10 years to bring a medicine to market. Only 12% of medicines that enter clinical trials are ever approved by the FDA. That doesn't account for the investment in basic research, in preclinical research. Biopharmaceutical companies take big bets every day, and we want them to take those bets, right? We want them to try to find a treatment or a cure for Alzheimer's. And at the same time, we want them to know that if they find something that works, there is a reasonable time and opportunity to recoup that investment, to fuel the next generation of innovation. And really, price setting and some of the policies that we're discussing interrupts that opportunity. And that's why, whether it's Republicans or Democrats, price setting really is the wrong choice for the American people, and the wrong choice for future innovation and the medicines all of us really want to experience into the future.
Peter, you have a possible solution. We obviously know the problem here, and it's pretty significant. Right. We only have a few minutes left. Could you summarize it for us?
Yeah, it actually aligns with what President Trump has been talking about. Senator Josh Hawley from Missouri and I have a bill which would say that American consumers will pay the average price that consumers in other countries pay, like France, like the United Kingdom, like Canada. So you would level it out. I mean, really, why is it that if you're a consumer here in the United States, you have to pay $12,000 versus the same product you can buy in the United Kingdom for $2,000? So what Josh and I are saying, and actually the president's been saying this, is let's have reference pricing. Let's even it out across the board. And by the way, that means that everybody can help pay for the research that is expensive, that goes into creating new drugs.
I didn't mean to interrupt you a second. When you say everybody can pay for the research, are you talking about other countries paying their fair share? Okay.
Absolutely. If you have reference pricing, then part of what goes into that is the cost of research. So, we've got a situation here in this country where the pricing power of entities is really being used in a way that makes it impossible and out of reach for families to get the things they need. So the pharma profits are very high. We can protect their capacity to do research, but we've really got to be thinking about those patients and the sustainability of having a healthcare system where in this country, we pay per person in this country, like $13,000 per person. In our European allies pay about $6,800, and it's not as though our health outcomes are better. Our life expectancy is lower than many of the other countries around. So price is an issue. Affordability is an issue. Access is an issue.
Elizabeth, we have a Democrat agreeing with President Trump. We're making progress here. So you have the last word. We have about 30 seconds left. Is it lowering the prices to try and get other countries to pay their fair share a way to go?
Yeah, respectfully to the senator, I would just say that in instances where insurers are not covering medicines, are creating hoops that are impossible for patients to access their medicines, it really doesn't matter what the price is. And if we're going to talk about providing Americans access to affordable medicines, we have to also tackle the fact that insurers decide what medicines are covered, how much they cost, and that people are frustrated because they are struggling to access medicines because of the barriers that are really being erected by our system.
Executive Vice President of PhRMA Elizabeth Carpenter and Senator Peter Welch of Vermont. Thank you both so much for a great conversation.